Good morning. Thank you for joining us today. My name is Hannah Fernandez. I'm the Business Development Manager at Primavera Health. Today's webinar will focus on the topic of how to position yourself to benefit from value-based care. We wanted to start today's webinar with a brief introduction to Primavera Health and really explain the purpose behind this webinar together today. Primavera Health was started by a group of healthcare providers who saw and experienced the struggle with their transition within healthcare to value-based care. Now in 2022, 5 years later, we are a strategic partner that helps healthcare providers and organizations really navigate the world of value-based care through providing tools and education. And we hope everyone attending this webinar or watching this webinar in the future walks away with additional insights on value-based care and has a better understanding of really how to position yourself or your healthcare organization through leveraging technology or seeking expert strategy. And we'll cover that through our agenda this morning. First, we're going to discuss the shift in healthcare from fee-to-service to value-based care. We'll discuss how to leverage your payers' data, how to identify patients in need of intervention, and then the importance of determining opportunities for improvement for cost reduction and revenue generation. And I'll show you how to leverage, identify, and determine utilizing your payers' data through our data analytics app. I would like to ask if you have any questions, if you could hold them till the end of the webinar, and at that time you can chat in with any unanswered questions you have, and we'll go ahead and get those answered for you. As an attendee of this webinar, I'm sure you are somewhat familiar with value-based care and the shift from volume-based or fee-for-service to value-based, right? The tricky thing is in this industry, value-based care sometimes means different things to different people, right? Depending on maybe your position, if you're a provider or in like a director's role, or your location, the state that you're in. Whether you're attending this webinar because maybe you're just interested in learning more about value-based care and the industry change, or you're already a part of a healthcare organization that's involved in value-based care with certain risk agreements with payers. And you're here to learn how to position yourself better through your data. No matter what, value-based care should be seen as an opportunity versus a challenge. And that's a part of what Primavera was founded on, helping leaders in this industry take advantage of the change instead of being hindered by it by any way. And although the healthcare industry and payers are slowly adopting value-based care across America, one thing is for sure, no matter what state you're in, value-based care and contracting is here to stay and is really ultimately the future for healthcare. We've already seen major payers, depending on your state, implement this change. And the industry is going to continue to find ways of improving outcomes at lower cost through value-based care. And the stats on the screen just show that. For example, according to healthcare, it's going to be about 1/3 of reimbursement contracts are value-based care. So that just shows the impact there. And according to CMS as well, by 2025, Medicaid providers will all be in a version of a two-sided risk arrangement, just showing those impacts. And all these stats are really telling and drawing in on healthcare continuously moving to value-based care. And with that comes the importance and demand for collecting and understanding payers' data. And at its core, value-based care focuses on improving patient outcomes and satisfaction, while also curbing overall healthcare costs. And that can be accomplished through positioning yourself through your payers' data. Now, payers' data can be a little bit complicated, but to simplify it, we've created it into or segmented it into 4 different parts here. And I like to refer to these as the value-based care, like puzzle pieces that you need to have together to get a full idea and impact of your clinical organization. So the first one being membership, tracking and understanding your membership or your patient trends is really critical. Identifying if you're staying stagnant or losing patients. Are you aware of these trends and maybe why they're occurring, where they're occurring at if you have multiple locations? Next is financial impact. This is essential for an organization to know, financial trends, then turn them into actionable decisions to increase revenue. Clinical impact. Again, one of the main purposes of value-based care is to improve quality of care and the payer's data allows you to identify opportunities for improvement. And then the last puzzle piece is cost reduction and revenue generation, getting a understanding of underlying health costs to increase revenue. Now, once you have these puzzle pieces and you combine the insights together, an organization is really empowered to make actionable decisions from that data that will impact positively and financially and have a positive impact on your patients as well. And now is really the time for providers and healthcare organizations to ensure they have access to their value-based care puzzle pieces, the memberships and everything, and have a solid foundation. The question is, how do you access your data, and once you have access to that data, how do you manage that data? How do you interpret that data to make decisions from? On top of that, a lot of providers are facing the challenge of, although they currently may have access to payers' data through their payers individually, it's an abundance of data, and they often lack the ability to have it accessible to them and amendable to analysis, right? Another challenge is an organization maybe has already implemented an EHR that has a version of data analytics, but those are typically built for fee for service. And the reality is they don't capture enough information to tell the whole story of an individual patient or population. They just don't really make it easy to share data with everyone who needs it from an EHR. And it's critical to utilize and implement the right tools and technology to really going yourself and prepare for this change that's going to continue to happen. It's the train that's not going to stop moving, right? It's going to accelerate further. And that's really where Primavera Health comes in. Our goal is to be a partner in your value-based care, really no matter where you're at within this journey. So we help and empower, promote readiness within two different strategies. The first one being providing a data analytics platform to leverage your payers' data in real time, providing you your data securely and in a manageable format, right? Format which makes sense, it's readable, it paints a picture of what's happening with your organization, which I'll show you in just a few moments through a demo of our data analytics app. Now, the second strategy is for those organizations that need a more hands-on approach, and that's through our professional services, right? This is where we help with the transitioning to value-based care, ensuring you're taking advantage of your payers' agreements, helping support you understanding the data and making decisions, as well as we help create an operational foundation. So once our professional services are over, your organization is stable and can utilize the data analytics independently and can continue moving forward with that. Now, before I jump into the demo, of our data analytics, I want to explain one of the important differences with Primavera, and that is our data integrity. Our team really prides ourselves on our ability, number one, to do automatic daily health checks of your payers' data that's continuously going into the system. We basically scrub and ID file errors up front to ensure the data pipeline is clean. So before any incorrect files are going in and disrupting the data that you're seeing, we make sure those errors are fixed ahead of time to make sure everything's clean and looks good on the user's end, on the provider's end. We also have the ability to automatically detect activity that may hinder your data through automatic validations, whether that's on the back end or front end. The second part to the data integrity is data manipulation. So we can roll back to an existing data set if needed, right? And that helps if a corrupted file is identified, it doesn't get uploaded any further, impacting your data. And then we have a real-time ETL process. And then the last aspect of our data integrity is client communication. Since we're continuously getting those file updates from payers within our data analytics app, we give our clients the ability to have full visibility in real time what's going on with their data. So basically, clients can get real-time notifications through email that will update them when we receive files, when a file adjustment's been made. They can have complete transparency into what's going on that end. And we really believe the combination of these three different aspects with data integrity, that we can provide clean data from multiple payers into one system, is really a game changer for the quality, again, of data we can provide our clients. So I'm going to switch to do a preview demo of our data analytics platform, where you can leverage your payer's data in real time. Real time meaning if a payer's file is updated, there's often other programs that take weeks, if not a month, to upload it into the system. So there's always going to be a delay there. We do it in real time. So usually within one business day, within the app, the data is uploaded for your team to view. So there's no delay in getting you up to date with that data. Let me go ahead and switch over. All right, so I'm already logged into the data analytics app. So let me explain what you're looking at first. So on the left-hand side, this is our menu. These are the different reporting tools and dashboards that we give you insights into those value-based care puzzle pieces that I just discussed. So we have membership, revenue, cost, service fund, performance KPI, and insight. And I'll show you different dashboards and reports in each section during the demo. So instantly as you log in, you're going to see the summary dashboard that you're looking at right now. This basically gives insights on a financial and clinical level directly. So you can see these first three gadgets. This is giving you information on your patient population. And then you have some financial indicators to track. So your funding per member per month, showing you the average, your inpatient versus outpatient, and your MLR directly. Of course, you can track and compare the current period to the previous period here as well. And then these two gadgets show you your admission trends, hospital admission trends, percentage directly, and then your percent of generic prescription tracking here, because obviously the higher the better for the percent of generic prescription to save the organization money as well as your patients. So you're able to track that as soon as you log in. So something unique about our platform, all the dashboards, all the reports within this app, you can customize directly, and that's through our filters. The filters are a huge advantage no matter the size of your practice. So you can really drill down and view the specific data set you want to see. So let me go ahead and show you those. So these are some of the filters. Each dashboard and report is going to have specific filters depending on the data it's showing you. But for example, you'll always be able to select a specific date range, primary provider. So for this example, there's two primary providers data we're looking at. We can drill down and view one if you just want. Insurance PCP, if there's multiple locations, a specific file here, a specific payer we want to drill down, a contract. If we're practicing in multiple counties, we can drill down to a specific county we want to view this data for. Age group, so there's lots of different options to drill down directly into that data that you want to see. Now, looking at this dashboard, a provider can really get a broad idea of the pulse of their patient population. But in order to really drill down into that data, they need to go into our membership section here, which again is one of those puzzle pieces I kind of explained. And these 3 different reports here under membership will help give you those insights on what's going on with your membership. So all 3 of these reports for membership are based upon your payer eligibility files here. The first one being the summary report. This is basically a grouping report to track memberships by these specific groups. So you can track your memberships by payers, location, primary provider, PCP, financial class, county, chronic condition. So just to show you a few examples, we switch to primary provider. You can see my 2 primary providers in each month, their membership population. And again, the date range is based upon the filters that I have selected here. So we can extend this to a full year or drill down to a couple of specific months that we want to view. It's completely up to you. Another example here is county. So you can see this gives you a breakdown if you have multiple counties that you're working within, and we'll calculate the net growth percentage. And we get the question of why is tracking membership information at this level so important? Grouping reports like these really help a provider and organization spot trends on growth, or in some cases get a better understanding of where they're staying stagnant, help identify why they're staying stagnant, also help balance out the membership panel as well, right? Now, all of these hyperlinks throughout the reports in the system are clickable that are blue, so you can actually drill down into this information directly. So I clicked on specifically, I think this was Care Plus. This is their member list. It was like 4,000. So this is showing all 4,000 of those patients. It breaks it down for you a little bit further by location, by provider here. And then you can actually drill down into the patient chart if you want. And the patient chart's actually going to show you different clinical and financial information here for you to see. So as soon as you log in, you're going to see their MRA score. You're going to see if they're low risk, medium risk, or high risk. And what's unique about our platform as well, you can customize what is considered low, medium, or high, because we understand each organization might have different standards as to where those thresholds land. So you have that customization option, or you can just leave it for industry standards. It's completely up to you. And again, we're providing financial information on this patient chart. You can scroll down and view the net premium, their outpatient costs, specialist costs, pharmacy, net revenue. There are a number of ER visits, inpatient, readmissions, if they were active or which months they were inactive. So we're giving you a full financial analysis on this patient chart, which is definitely really beneficial. So I want to go ahead and show you the next report here, which is our trend graph. This provides additional details directly on your patient trends. So you can see each month your starting membership, new enrollments, disenrollments, start duplicates if there's any, start contracts. And we also calculate your percent of churn and monthly retention here. So you can track that each month. This is a great report for those organizations that are looking to grow, to kind of track their progress moving forward. If you want to view more details, you can by clicking this button, and we're going to provide you some additional information. You'll see throughout the system, there's lots of reports where you can expand the data, or you can just narrow in on the data set presented. So we also provide the churn variance, end duplicate, end contract, dual payer membership, all for you to track directly. Now, all of these reporting options, you can switch over to a visual graph, a bar graph here for you to view. directly, or you can switch to this view. So we have a list view of your membership trends and then the visual representation as well. Now, through the next report, we provide a way of tracking disenrollments or enrollments of members of an organization. That is our transaction logs. So this is actually where we take payers' files and we're able to identify if there's a member that disenrolled from your organization or you have a new patient that enrolled with you. So you're going to see the patient's details, and the type is where we tell you this was a disenrolled patient or an enrolled. The important part of letting you know or alerting you of a patient status like this is you're able to be proactive, right? So if this is a new patient, you can actually create a task for someone within the office, maybe it's a front office manager, to ensure they have their first appointment scheduled. Or maybe this is a disenrolled patient. Maybe you want to send a courtesy survey out to them to get some feedback onto, why they disenrolled with your organization and see if there's any room for improvement. And really, this tool helps identify, this is one of the tools that helps identify patient gaps, right? And get that feedback directly. And you wouldn't know this information without this report directly. And through the membership summary, trend graphs, and transition logs, now a provider and organization is really empowered to identify these trends that they would usually otherwise never really be aware of. Just as important as understanding memberships is understanding financial impact as well. So I want to shift to some of the financial reporting that we have available. Now, when a provider is in value-based care, it's essential for them to know their MLR, their MRA, their cost drivers, and understand financial information overall in order to take advantage of their risk payer agreements and to really ensure they're not leaving money on the table for payers. And that's exactly what our reporting tools empower providers to do. An important part of tracking financial impact is MRA, also known as RAF score. And it's really a fundamental part of tracking within value-based care. So this is the report, our profitability driver MRA RAF report to track your MRA by groups again. So this is showing your MRA average per payer. It's going to give you a breakdown by month again. You can see your MRA by your physicians, your providers here. Again, one of the many reports where if you don't have this reporting tool available at your fingertips, it would be really hard to calculate these averages overall for you. And then we have group as well. Now this report focuses just on MRA, so I'm going to switch to our service fund report, which provides multiple different financial indicators to track that are impacting patients and the organizations directly. So this is our service fund report. This offers a holistic or summary view of how an organization is doing as a whole. This is really where our team takes the provider's financial data and deciphers it for them, showing not only the data, but the impact directly. So let me explain what you're looking at here. So on the left-hand side, we have all the financial indicators. There's 26 here. So everything from tracking the net premium to total capitated expenses, pharmacy cost, reinsurance premium, total medical cost, net revenue. We show you those different indicators here. Of course, you're tracking them by month directly, so we show you those. We have the average over here as well for each indicator. Now, you'll see several of these indicators. We provide the details of what's included. So what's included in your inpatient total? We provide you that breakdown. We provide you the breakdown of your specialist, what's included. So again, those are one of the many details that it would be hard to grasp and be able to view without a robust report like this. And not only is this report available on the payer and provider level, utilizing those filters, you can drill down to a specific payer or provider. You can also switch to PM, which is going to show you the average per patient here. So you can see your average net premium per patient each month, your total FFS expenses each month, and track that at that level. We are adding a prediction column here. So it'll be after the average column. So for example, based upon the last 6 months, this is where your memberships will be. So we'll be able to help providers with planning and setting a course of action based upon that prediction option. And without this report, a healthcare organization just doesn't have financial information like this at their fingertips to analyze directly, including these details, right? Now, this is one of the many reports within the platform that empowers you to track and directly view your financial impact. Now, to track some of more important financial cost drivers, we have our top utilizers report. And that's where you can really identify opportunities for financial improvement through those different gadgets that are on that report. So let me go ahead and switch over. So through these different gadgets that you'll see on the screen, this shows different elements that are directly impacting a practice or an organization's cost. So you can see your memberships by payer directly for each month, your average encounters per day, your MRA or RAF scores comparing your MLR percentage. Obviously, prescription costs has a huge impact on the revenue of a practice. So we have these two different gadgets to track the percentage of generics by payer or the average cost of prescription by payer as well. Now down here, we have some really unique tools. We identify first your top 15 highest utilizers, your patients. This is basically your top 15 patients that are costing the organization the most. Then we identify your top 15 drugs, whether it's brand or generic. Obviously, the more generic, the better on your top 15, so you can track that directly and identify room for opportunity. And then we identify your top 15 frequent flyers and top 15 flyers of the emergency room. What's unique here, so we not only do we identify these patients for you, utilizing our case management app, you can actually create a case, right, and try to reduce the readmission rates of these patients directly. Maybe there needs to be a revision of their plan of care. If these admissions are preventable, that there needs to be some kind of revision there, and we give you that action there. We also provide you the top 15 highest expense CPT codes. We identify those for you. And simply without this tool, a provider would really struggle to drill down into exactly which patients are costing them the most at this level and the direct impact, right? So we provide this report and providing that actionable data to go in and do some further analysis of these patients, see if there's room for opportunity financially. Now, once a provider has an idea of where they're positioned financially, they can switch to our performance KPI tool, which offers a way of tracking specific KPIs that are directly related to financial numbers, membership growth, and overall patient experience. So what you're looking at first, you can see that there are 50 KPIs to track. All of these are on the left-hand side. There is a lot to choose from, right? If some of these KPIs don't apply to an organization, they can simply just remove that KPI. So these are optional. We figured if we can provide more KPIs to track, the better. So they're all available there for you. A few unique things here. You can group these KPIs by payers, by providers. So for example, I'm going to switch these KPIs to track by primary provider. So you can see I have Dr. Bailey here. These are her KPIs directly. You can actually set benchmarks or goals for each group and each KPI. So we might have Dr. Bailey and Dr. Smith. Each one's going to have different KPIs. Maybe one works part-time, one works full-time. So you can adjust these KPI goals and track them over each month. So you can see, for example, inpatient admits per 1,000, they have a goal of 180 to 140 monthly. Now, the months that have been marked red, they did not meet that goal. And then green, they did meet that goal. So they can track these monthly. These are clickable hyperlinks again, so they can drill down into that data directly. And this kind of dashboard with KPIs really allows a practice to make sense of the past and plan for future performance, right? It's critical for a practice to track these KPIs because they are ultimately impacting the success of a practice. And we've gotten really great feedback from this KPI dashboard here. Now I want to move to our insight reporting tools. There's 6 different reporting tools here. So we have chronic condition, summary 360, patient gaps, risk stratification, trending high risk, and CPT codes. These were created to determine opportunities for improvements in, number 1, cost reduction, and then number 2, to help generate revenue directly. And then we also help identify patients in need of intervention to help improve outcomes. So a few of these reports here I want to go over with you. The first one being chronic condition. Since chronic conditions can be a huge cost driver for a provider, this tool really allows a provider to monitor and track what chronic conditions are impacting their patients most. So they can track just the general prevalence of their chronic conditions among their members. Maybe they want to see their prevalence of chronic conditions by a specific age range. They can track their chronic conditions by female versus male. And then they can track as well as Medicare only versus Medicare and Medicaid dual. So there's lots of different gadgets here that not only lets you know, hey, these are your chronic conditions, this is where the cost drivers are. We're providing another level of breakdown of these chronic conditions for you to track and really help identify cost trends of these chronic conditions up front. Because again, you can utilize those filters and drill down to a specific date range, and you can compare to the next date range you want to compare. Another tool to really help an organization be proactive with patients, both clinically and financially, is our patient gaps tool. This is a really unique reporting tool where we identify patients for you that are in need of intervention to help improve outcomes. And where you basically take internal algorithms, utilizing your payer files, and identify room for improvement. There's patient gaps. So there's a few examples here. So the first example we have for Jane Doe, this is a new patient pending a visit. So this is basically where we've identified Care Plus, for example, they're a new patient with you, and for 3 months they've been your patient, and there's been no claim data entered to Care Plus. So we've identified there has been no visit. And so from here, we're providing you that actionable insight. You can actually create a case directly and ensure that you're following up with them, giving them a courtesy text message or email, whatever the process is within that organization, to ensure they're getting their appointment scheduled, they're getting their yearly exam, getting those preventative things scheduled internally. Another example is we identify patients with a MLR that's over 400%. So this is a high cost driving patient, and we identified that upfront for you directly. you're not having to sort through different patient files. We go ahead and identify those up for you up front. And without a tool like this, providers are in the dark as to what patients are falling through the cracks. And manually identifying these patients take so much time and resources from a practice, and this helps alleviate that manual process. Now, the next reporting tool is risk stratification. This is where our system automatically identifies, using internal algorithms, the top patients that are trending high risk. So here is where we identify the patients that are either have a really high expense rate, revenue rate, and then from here you can actually create a case directly. So wrapping up this demo, I'm sure that you can see that our data analytics platform was really created to help manage payers' data, but also position yourself to benefit from it as well. And we really believe that this helps improve patient care and improve financial status of an organization as well, right? And our difference is not only providing a healthcare organization their quality payers data and insights through the reports and dashboards I just showed you, but we offer the option of the professional services approach as well, assisting in not only understanding what data is telling you in an organization, but helping strategizing in patient outcomes and identifying opportunity for financial improvement. And Primavera really works with you really no matter where you're at during this journey with our data, insights, strategy, and action. So far, we've also had the opportunity to help over 6,400 providers, impacting over 200,000 patient lives and processing over 10 million claims files to analyze within the app. And we're really looking forward to continuing to grow our impact even further. Thank you all for taking the time for today's webinar. Hopefully this was insightful for you and your healthcare organization. If you would like to schedule a one-on-one demo with our team to deep dive into our data analytics app further and go through any specific questions you may have, or if you want to schedule a follow-up together just to continue the conversation, please let us know. My contact information is on the screen, as well as you can chat in with any additional questions you have at this time. So I'll just wait a few more minutes on this webinar and see if there's any questions. All right, doesn't seem like there's any questions. Thank you again for hopping on the webinar today.